Hi, I'm Dr. Susan Nasab, IVF specialist and reproductive surgeon. And one of the most common questions I get is, do contraceptives affect your fertility? Let's talk about it. This is a great question, and the short answer is no, contraceptives don't harm your long-term fertility. But to really understand why, let's break it down step by step. First, let's start with birth control pills. These work primarily by preventing ovulation, meaning they stop your body from releasing an egg each month. While you are on the pill, you can't get pregnant because ovulation isn't happening. Once you stop taking the pill, your body usually resumes its natural cycle within a few weeks to a couple of months. Some people might notice their first cycles are irregular or ovulation takes a little while to normalize. This doesn't mean the pill damaged fertility. It's simply your body readjusting after being on a steady dose of hormones. It's important to remember that if conception takes longer, the cause is usually unrelated to past contraceptive use. Next up, IUDs, both hormonal and copper. These are among the most effective and convenient forms of contraception. Hormonal IUD releases small amount of progestin to thin the uterine lining and make it harder for sperm to reach to the egg. Copper IUDs, on the other hand, don't use hormones. Instead, the copper creates an environment that's toxic to the sperm, preventing fertilization altogether. A lot of people wonder where having an IUD in place for years might impact their future fertility. The answer is no. Once the IUD is removed, your natural cycle returns often within the very next month. Many patients conceive quickly after removal, and there is no evidence that IUD reduce equality or damage reproductive health in the long run. Now let's talk about emergency contraception, like Plan B. This is a high dose of hormones taken shortly after unprotected sex to temporarily delay ovulation. It's intended as a backup method, not a replacement for regular birth control, since it's less effective. But one thing to emphasize is that it doesn't cause infertility. It doesn't damage your ovaries, uterus, or long-term reproductive function. Using Plan B on occasion when needed won't affect your ability to get pregnant in the future. Something I really want to highlight is this. If you stop using contraception and you don't conceive right away, it's natural to wonder if birth control pill caused the problem. But in reality, fertility depends on many factors: age, egg quality, sperm health, regularity of ovulation, and other underlying conditions like thyroid disorders or endometriosis. These factors and not contraceptives are usually what explain difficulty conceiving. So to wrap up it all, contraceptives temporarily prevent pregnancy, but they don't cause infertility. Once you stop using them, your natural fertility potential comes back. If you haven't been trying for several months without success, especially if you're over 35-year-old, it's worth checking it with a fertility specialist. Getting guidance early can save time and reduce stress. Thanks for watching, and feel free to leave a comment or suggest future topics you would like to see. And don't forget to like and subscribe for more fertility education and support.